Today we will be presenting to you about oral health care for infants. This presentation is presented by Carly, Kylie, Riley, Justine, and Nayeli.
Listed here are the different trimesters of pregnancy and when you can and cannot get dental treatment. So in the first trimester, preventative work can be done, which would be your basic cleanings and exams. But you should avoid any restorative procedures. So this would be if you went to a cleaning and you needed a filling, your dentist might put that off. In the second trimester, this is when it's the safest to get your dental treatment done. So they may wait until this trimester to do any fillings. And then in the third trimester, after the middle of it, elective dental treatment should be avoided. So when you're getting towards the end of your pregnancy, they may wait until you give birth to do these dental procedures.
Before the baby is born, there can be some things that can happen to the mother's teeth, which would be morning sickness. This would be when the mother vomits. Vomiting, oftentimes morning sickness can lead to vomiting, which coats the teeth with acidic contents from the stomach. This can cause dental erosion. Erosion is when the acidic contents of the stomach are left on the teeth. The best way to prevent this would be swishing with water for 30 seconds after vomiting. Brushing your teeth right away can spread the acidity through your mouth, and it can also cause toothbrush abrasion, which is when the tooth softens enough that the toothbrush can cause lines on the teeth from it softening.
This is an image of when you can expect your baby's teeth to erupt and when to expect that they fall out. As you can see, the first set of teeth that will come in are in yellow. They're called their central incisors, and more likely than not, you will have the bottom incisors that will erupt first at about 6 months old. And then to follow would be the top middle two front teeth, central incisors, at about 8 to 12 months old. You can see the next set of teeth to erupt would be in green. Those are called our lateral incisors. And then next would be in red would be the molars, their first molars. Then to follow at about 16 to 22 months would be their canines. Those are the ones in blue. And then the last set of baby teeth to erupt would be the second molars. And those generally erupt around age 2 up until 33 months, and those are the ones that are in orange. You can expect your baby to be fussy, possibly drooling a lot. Their gums may even appear a little irritated and swollen, and that is completely normal. Things that you can do to kind of help the eruption process with your baby is maybe rub the gums with your finger. Sometimes you can have them chew on teething rings, things like that. That will help kind of give comfort to your baby's mouth.
In this slide, we're going to talk about the milestones from newborn and 1 year. In the newborn stage, it's important for the mother to be taking care of her oral health. Be careful not to transmit bacteria from adult to baby. This can happen by kissing your child on the lips or cleaning their pacifier with your mouth. From 0 to 5 months, you can begin taking care of your child's oral cavity by wiping their gums after each feeding with a clean, damp cloth. From 6 months, by this age, this child should begin cutting their first tooth. You can start brushing a tooth twice a day using a smear of toothpaste. Also avoid sugary foods. In 1 year, make sure to have your child's first dental visit scheduled by their first birthday. If you do not have a dentist, you can check with your pediatrician. In this video by Pampers is going to show you when and how to clean a baby's teeth.
Here's a picture of what a child's primary teeth should look like. They're healthy, well taken care of, brushed 2 times a day, and cavity-free. Many parents worry about the spaces between their child's primary teeth, thinking they will need braces later on in life, but that's not always the case. The spaces between a child's primary teeth are actually a good thing. The spaces allow for the new permanent teeth to grow and develop in the mouth. It's important you brush your child's teeth in the morning and at night before bed, so they don't get a cavity. Even though your child's primary teeth will fall out, it's possible for the permanent tooth that grows in its place to be affected by the cavity.
Early childhood caries, or also known as ECC, is one of the most prevalent diseases in children worldwide. In the first picture listed here is the white chalky stage. You may notice plaque present in this stage as well. In this stage, it may be reversible with good oral hygiene and remineralizing agents such as fluoride. In the next stage, or the brown spots picture listed in the middle here, you may notice these brown spots on your child's teeth. This may mean that there is dental involvement and your child may complain about sensitivity to cold. In the last stage listed, there is full dental involvement and your child may complain of constant pain. Once the decay reaches the traumatic stage, the pain for your child may go away as the tooth is now non-vital. It is very important to visit the dental office frequently and to take your child in for a visit if you notice any slight change in their teeth.
There's a few things that can cause childhood caries. One would be going to bed with a bottle containing milk or juice. This would be because there is no saliva flow to flush away those sugars. Another would be eating a high sugar or carb snack frequently. The more common or the more often that you eat the high sugar or carb snacks, the more sugar is introduced to the teeth and the easier it is for a cavity to begin. Another would be inadequate home care, which would be not brushing your child's teeth or flossing your child's teeth as often as it should. And another would be sharing utensils because the bacteria in your mouth can spread to the child's mouth through utensils or also putting their binky in your mouth to clean it off.
Listed here on this slide are healthy snacks for your child. Dairy is a really good option as it has all of the nutrients that are essential for the development of the teeth, such as milk and string cheese. Fruits are also a very good option. Some examples are bananas, apples. Some fruits like lemons and oranges are very acidic, so it's important to rinse your child's mouth with water after they eat them. Veggies are also very good for essential development of the teeth. And some good options are broccoli, carrots, and there are many others that are not listed here.
You should take your child to their first dental visit at the time that they have their first teeth erupt or by at least age 1. The reason we want you to do that is it is important to start your child young and to start building that trust between the dentist and the staff and with your child to kind of ease their anxiety so they're not scared to come see us. This also helps instill a positive dental attitude, so your demeanor is also very important to make sure that you are positive. That way your child also has a positive experience. You can expect at your first dental visit for the dentist to observe what the inside of their mouth looks like. They will also ask some questions about their oral habits. For example, does your baby suck their thumb? They'll want to know things about when they eat, what they eat, also their drinking habits. Do you give them a bottle at bedtime or do they only drink with meals? You can also learn some tips on brushing and oral care for your baby and how to make sure that you keep their mouth clean while their teeth are coming in. You want to make sure to prepare for this first visit to make sure that your child has had a good night rest of sleep the night before and that we can keep them anxiety-free and stress-free for everybody.